aorta, and when it lies, it continues forward and further in the abdominal cavity when it is located. It is called as the abdominal aorta. The abdominal aorta, it terminates by dividing into the terminal division that is called as the common iliac arteries. And these common iliac arteries are divided further into the internal iliac and the external iliac arteries. Internal iliac artery is something which is related specifically to the region of the pelvis and perineum. ये और जो lower abdominal viscera होते हैं which are located within the distal parts of the abdominal cavity, उसको blood supply करती है. In contrast to that, we have got the external iliac artery. External iliac artery is the one which is associated with more perineal regions, with the skin and the subcutaneous tissues of the groin and the perineal region, and it continues forward as the femoral artery. It is basically the sole supply of the lower limb. So external iliac artery, it continues forward as the femoral artery. The femoral artery, going through the flow chart, the femoral artery, it divides into some of the branches. It gives off some of the branches. The one of very important branch is the deep femoral artery, which is also called as the profunda femoris artery. The word profunda means deep, and when it goes into the posterior compartment, it's called as the deep femoral artery or the profunda femoris artery. So it is the supply of arterial blood to the posterior compartment of the thigh. Then it gives off another branch, another important branch, which is called as the descending genicular artery, which is associated with giving off the blood supply to the knee joint by forming the genicular anastomosis. If you look at the deep femoral artery or the profunda femoris artery, it gives off two important branches, which are called as the lateral and medial circumflex femoral arteries. One of the major source of the blood supply to the musculature of the quadriceps muscle and the adductors and the obturator muscle, it is by these medial and lateral circumflex femoral arteries. But a very important functional aspect of these circumflex femoral arteries is that they are responsible for forming the anastomosis at the level of the thigh region. So they are associated with forming the both the trochanteric anastomosis as well as the cruciate anastomosis. They do take part very actively in the formation of both these anastomoses. Then we have got the femoral artery. It continues forward and it becomes the popliteal artery once it lies within the popliteal fossa. So this popliteal artery, it is located inside the popliteal fossa. It gives off blood supply over there to some of the musculature and the skin of that region. And then as it descends downward at the lower border of the popliteus muscle, it is divided into its two terminal divisions. One is the anterior tibial artery and the other one is the posterior tibial artery. Anterior tibial artery, it runs anteriorly, and posterior tibial artery runs posteriorly. So anterior tibial artery is the sole source of blood supply to the anterior compartment of the leg or the extensors of the leg, while posterior tibial artery is the sole source of blood supply to the posterior compartment of the leg or the flexors of the leg. Other than that, the posterior tibial artery, it gives off another branch which is called as the peroneal artery or the fibular artery. And I have told you many times, whenever this peroneal word comes in front of you, just think of the fact that it belongs to the lateral side of the leg. Okay? So definitely this peroneal artery is, as its name is indicating, it is the arterial supply for the lateral side of the leg or the lateral compartment of the leg. Now both of these anterior and posterior tibial arteries, they are responsible for giving off the branches, some of the terminal branches. The anterior tibial artery itself, it continues forward on the dorsum of the foot as the dorsalis pedis artery, and the posterior tibial artery, it divides into the plantar arteries, the medial and lateral plantar arteries. Now both of these arteries, the anterior one as well as the posterior one, they are associated with forming the arterial arches. And these arterial arches are formed on the dorsum of the foot as well as on the plantar aspect of the foot. that we are going to see in detail how these arterial arches are being formed. So with that, the arterial supply is terminated at the level of the foot by forming the arterial arches. So this is a flow chart which is showing right from the beginning till the end के किस तरह से blood supply होता है in the lower proximity. Now we are going to have a look at each of the artery briefly, one by one. So the arterial supply, which is beginning from the level of the common iliac artery. Common iliac artery is bifurcated into external and internal iliac artery. Just look at the anterior aspect of the lower leg. The picture on the left side. So this external iliac artery, this one is the internal iliac artery. It continues forward. When it comes down underneath the inguinal ligament, it becomes the femoral artery. Femoral artery gives off the deep femoral artery or the profunda femoris artery, which is giving off the lateral circumflex femoral artery. Then it continues forward. This femoral artery, it gives off genicular branch. It continues forward within the popliteal fossa as the popliteal artery. The popliteal artery is divided into its two terminal division. One is the anterior tibial, the other one is the posterior tibial. Posterior tibial, it gives off another branch which is called as the fibular artery, and then this anterior tibial, it descends on the, it continues on the front or the dorsal aspect of the foot as the dorsalis pedis artery, and this dorsalis pedis artery is forming the dorsal arterial arch. And if we look at the posterior aspect of the leg and the posterior aspect of the lower extremity, we would be able to appreciate again the femoral artery, the genicular branch of the femoral artery, and then the popliteal artery. Popliteal artery, if you trace it downward, you would be able to appreciate its terminal divisions by the anterior tibial and the posterior tibial. Posterior tibial is also giving off the peroneal artery over here, and then it continues downward. This posterior tibial is divided into the lateral and medial plantar arteries, and these plantar arteries are responsible for the formation of the plantar arterial arch on the sole of the foot. So this is how this is the diagrammatic view of the arterial supply of the lower extremity. Now moving on to the external iliac artery, the arterial supply in the lower extremity, it begins basically with this iliofemoral system, arterial system. And the common iliac artery is bifurcated at the level of the sacroiliac joint in the pelvic brim. Pelvic brim, मैंने आपको याद होगा कि पहले भी बताया था, that is the line of demarcation between the true pelvis and the false pelvis. We have got false pelvis or the broader pelvis above, and we have got the lesser pelvis or the true pelvis below. And there is a line of demarcation which is actually formed by the arcuate line of the two hip bones, and this line of demarcation is called as the pelvic brim. So the pelvic, above the pelvic brim lies the false pelvis, and below the pelvic brim lies the true pelvis. और उस pelvic brim की level के ऊपर, that is an important anatomical landmark, the common iliac artery is bifurcated into the internal and the external iliac artery. The external iliac artery, it continues forward. It passes underneath the inguinal ligament. If you look over here in the picture, the inguinal ligament आपको नजर आ रहा है, यहाँ पे एक ligamentous structure है which is extending from the anterior superior iliac spine till the level of the pubic symphysis, and underneath this crosses the this external iliac artery, and it becomes the femoral artery. It changes its name as soon as it passes underneath the inguinal ligament. It is now called as the femoral artery. Okay, now the femoral artery, which begins at the level of the inguinal ligament, and it gives off just after, as it crosses the inguinal ligament, just after crossing a distance of about 3 to 3.5 centimeters, it gives off its first branch, which is a very large bore vessel, which is called as the profunda femoris artery. And this profunda femoris artery ये इसी लेवल के ऊपर posteriorly run करती है and it goes on to the posterior compartment of the thigh to supply that region. The femoral artery itself, after giving off this profunda femoris branch, it extends down into the thigh. It crosses anteromedially and it passes through an opening in the adductor magnus muscle, which is called as the adductor hiatus. इस hiatus के through ये cross करती है and it enters into the from anteriorly, it goes posteriorly and it is now called as the popliteal artery once it is located inside the or on the back side of the knee joint. That area is called as the popliteal region, and over there the artery is now called as the popliteal artery. So it has got a whole course. It traverses the entire length of the thigh right from the beginning till the end, and it goes from the anterior side to the posterior aspect of the thigh, and over there it is now called as the popliteal artery. The branches of the femoral artery, there are multiple branches given off to the femoral artery, like the superficial epigastric, circumflex iliac, external pudendal, internal deep external pudendal. The upper four arteries, that's the external pudendal and the circumflex iliac and the epigastric arteries, they are associated specifically with the region of the groin, with the region of the perineum, and they are associated with giving of the blood supply to the overlying skin, subcutaneous tissue, fascia of that specific part, as well as the deeper structures which are located inside it, like the inguinal lymph nodes. Inguinal lymph nodes or in सब areas को ये वाली जो branches हैं femoral artery की, they are associated with giving of the blood supply. But specifically to the lower extremity, we have got the arterial branches, that's the profunda femoris artery, which goes posteriorly. The femoral artery gives off the muscular branches to the muscles of the anterior compartment of the thigh, and it gives off the descending genicular arteries, which are responsible for forming the genicular anastomosis at the level of the knee joint. So these, the lower three arteries are specifically located. They are destined to give blood supply to the lower extremity, while the upper four ones are those which are associated functionally with the groin region and the perineal region. And the superficial structures as well as the deeper structures, they got the blood supply from these branches. Now the profunda femoris artery, it's the largest branch of the femoral artery that begins about 3 to 3.5 centimeters below the inguinal ligament. And it arises posterolaterally, basically from the femoral artery. And during its course, it gives off many important branches, like the lateral and medial circumflex femoral arteries, and it gives off the muscular branches to the muscles of the posterior compartment of the thigh, as well as it gives off the perforating branches. 4 perforating branches are basically given off by the profunda femoris artery, or rather I would say 3 branches are being given off from the profunda femoris artery, and the 4th perforating one is actually the direct continuation or the direct termination of the profunda femoris artery. So अगर आपके पास एक MCQ आ रहा है that how the profunda femoris artery is terminated, so the right option for that is the 4th perforating artery. The exact point of termination or the continuation of the profunda femoris artery itself, it becomes the 4th perforating artery. Now these perforating branches as well as the medial and lateral circumflex femoral arteries, they are associated with forming the anastomosis, cruciate anastomosis, trochinteric anastomosis, and then the genicular anastomosis. These सारे जो anastomosis है, they are located at the back of the thigh and the back of the knee joint, and they are they are an extensive source of blood supply to these specific region, to the hip joint, to the knee joint, and the back of the thigh. So these are the branches given off by the profunda femoris artery. Moving on further. Now the popliteal artery. Popliteal artery is actually the direct continuation of the femoral artery. Femoral artery को कभी भी कभार जो proper femoral artery है, which is located on the anterior aspect of the thigh, it sometimes may be labeled as the superficial femoral artery in contrast to the profunda femoris artery. So it could be labeled as the superficial femoral artery, it could be labeled as common femoral artery, or it could be labeled as the femoral artery only. But all these three vessels are named for a single artery which is located, which is running anteriorly on the thigh, and it continues as the popliteal artery once it crosses the adductor hiatus. Okay. Now this popliteal artery, as soon as this femoral artery it comes to lie in the popliteal region, it changes its name and it will be called as the popliteal artery. Now this popliteal artery, it goes downward, it descends downward, and at the lower border of the popliteus muscle, or you can say at the lower border of the popliteus fossa, which is a diamond-shaped space on the back of the knee. This popliteal artery, it will be divided into its two terminal branches. That is the anterior tibial and the posterior tibial arteries. The anterior tibial artery is more larger branch or the larger terminal branch of the popliteal artery as compared to the posterior tibial artery, because it has to cross a more longer course as it has to come from posterior aspect to the anterior aspect of the leg, and that's why it is comparatively a larger terminal branch. The branches which are given off by the popliteal artery, other than its two terminal subdivisions, they are the cutaneous branches. These cutaneous branches of the popliteal arteries are responsible for giving the blood supply to the skin, both on the front as well as on the back of the knee joint. Okay. Then it is associated with giving of the blood supply to some of the muscles. Muscles कौन-कौन से होते हैं? By means of the sural arteries. There are small unnamed branches, as well as there is a sural artery, which is a named artery of the popliteal, named branch of the popliteal artery. That's the sural artery. Now these branches, the unnamed muscular as well as the sural arteries, they are associated with giving of the blood supply to the triceps suri. Triceps suri, क्या होता है? Come on, quickly reply me in the chat box. You have done the posterior compartment. Quickly tell me in the chat box that what is triceps suri. Two heads of gastrocnemius and one head of soleus. Yes. Triceps, yes, these are actually the calf muscles. Okay, good. So yes, Achilles tendon is made up of this. Very good. So triceps suri is basically a combination of the three superficial muscles of the posterior compartment of the leg, that is the biheaded gastrocnemius along with the soleus muscle. And sural word is specifically associated with this triceps suri. So it will not give blood supply to the deeper muscles. Rather, जो superficial deep muscle, superficial muscles है posterior compartment के, उनके साथ ये उनको ये blood supply देती है, and it is associated with the triceps suri. Other than that, it also gives off branches like the superior, middle, and the inferior genicular arteries, which are extensively associated with forming the genicular anastomosis along with some of the branches of the profunda femoris artery and the femoral artery itself. Okay, so these are some of the branches of the popliteal artery. Now moving on further. The anterior tibial artery, one of the terminal and a larger subdivision of the popliteal artery that actually originates at the back of the leg. But what happens that it passes through the biheaded origin of the tibialis posterior muscle, and over there it pierces the interosseous membrane and it comes to lie anteriorly on the front of the leg or on the anterior aspect of the leg. Then it descends down anteriorly. अगर आप यहाँ पे picture में देखें, so this is the anterior tibial artery, which is a boxed structure shown in the picture. ये एंटीरियर टिबियल आर्टरी है और ये एंटीरियर टिबियल आर्टरी जो है इसके बिल्कुल जस्ट बिहाइंड दैट और पोस्टीरियर टू दैट वी विल बी एबल टू सी अ whitish structure, a whitish membrane which is actually the interosseous membrane. An interosseous membrane is a membrane which is binding the two borders of the tibia and the fibula, and it has got a hole or you can say एक इसके अंदर opening होती है in the proximal part of the membrane which is giving passage for the anterior tibial artery. So through that the anterior tibial artery it comes to like anteriorly, it descends down straight in the leg, and over here it is accompanied by the deep fibular nerve which is the nerve of the anterior compartment. और यहाँ पे ये स्मॉल मस्कुलर ब्रांचेस जैसे जैसे ये अपना कोर्स कवर करती जाती है it gives off a small muscular branches twigs देती है which are associated with giving of the blood supply to the muscles of the anterior compartment of the leg, and then it descends down further. It passes through both of the retinaculum, the superior extensor retinaculum as well as the inferior extensor retinaculum, and once it crosses the inferior extensor retinaculum it comes to lie over the dorsum of the foot. Over here it is now labeled as the dorsalis pedis artery. This anterior tibial artery, it gives off very important branches which are the malleolar arteries responsible for forming the malleolar anastomosis on the lateral and the medial malleolus of the tibia and the fibula respectively, along with the branches of the posterior tibial and the peroneal arteries. Okay. Now the posterior tibial artery, which is again a branch of the popliteal artery, formed by the bifurcation of the popliteal artery, and it passes. It do not need to come to lie anteriorly because this is the artery of the posterior side of the leg. So it remains on the back of the leg and it descends down. It is accompanied by the tibial nerve during its course, and it gives off a very important branch which is called as the fibular artery or the peroneal artery. In the beginning, जैसे ही bifurcate होती है popliteal artery into the anterior tibial artery, तो एक तो anterior tibial artery उसकी branch निकल जाती है. Secondly, it gives off a trunk which is called as the tibio-peroneal trunk, and this is a large bore vessel as compared to the anterior tibial artery because it's a trunk, and this trunk it needs to be divided into two terminal branches. One is called as the posterior tibial artery and the other one is called as the fibular artery. So basically trunk निकलता है popliteal artery में से other than the anterior tibial artery, and that is called as the tibio-peroneal trunk, which now divides into two branches. One is the posterior tibial artery and the other one is the peroneal artery or the fibular artery. Then it descends down, this posterior tibial artery, it descends down on the back of the leg, it reaches to the foot, and once it reaches to the foot, it passes behind the medial malleolus, and it terminates by dividing into the medial and lateral plantar artery, which is associated with giving of the blood supply to the sole of the foot by forming the plantar arterial arch. Another artery which is given off, another branch which is given off by the posterior tibial artery, which is also shown over here in the picture, is called as the deep plantar artery. अगर medial plantar artery को आप देखें, which is a boxed structure, उसके नीचे बिल्कुल लिखा हुआ है deep plantar artery. So that deep plantar artery is basically a branch of this posterior tibial artery, which gets continued with the dorsal arterial arch. ठीक है, ये एक it's actually the part of the posterior tibial artery which is associated with forming the dorsal arterial arch, and that part is called as the deep plantar artery, which goes through deeply through the bones of the foot, and it comes to lie anteriorly, and it contributes in the formation of the dorsal arterial arch. So we have got the formation of the two arterial arches, one on the dorsum of the foot, the other one on the sole of the foot. Dorsalis pedis artery, which is the continuation of the anterior tibial artery on the dorsum of the foot. Its branches are the lateral and medial tarsal arteries. It gives off the arcuate artery and it gives off the dorsal metatarsal artery. So now we are going to have a look at the picture first. If you look over here, आप देखें तो anterior tibial artery, once it goes, it descends and it comes to lie on the dorsum of the foot. It has now changed its name and it is called as the dorsalis pedis artery or the dorsal artery of the foot. Now this dorsalis pedis artery, if you look further, it is divided into, it is giving off two branches. One is called as the lateral tarsal artery, the other one is called as the medial tarsal artery. Now, lateral tarsal artery is comparatively a big bore vessel. It is a larger branch as compared to the medial tarsal artery. And this lateral tarsal artery is giving off the blood supply to the tarsal bones of the lateral aspect of the leg, while the medial tarsal artery is giving off the blood supply to the medial tarsal bones of the foot. Okay? And now it gives off this dorsalis pedis artery, it gives off another branch which is called as the arcuate arteries. Now what is this arcuate artery? The word arcuate itself is representing arch-shaped structure. The word arcuate means arch-shaped structure. जब भी arcuate का word आएगा आपके सामने, just always think that this is something related to an arch-shaped structure. So this artery is also labeled as arcuate artery because it is an arch-shaped structure. और arched artery कहाँ run कर रही है? It is running on the basis of the metatarsal bone or on the distal end of the metatarsal bone. So this is the distal end of the metatarsal bone और उसके ऊपर ये arch बनाती है and that's why it is called as the arcuate artery. Medially, it is associated with directly with the trunk of the dorsalis pedis artery. But when this arch it goes laterally over here, it is joined by the lateral tarsal artery. Okay. Now this arcuate artery and this dorsalis pedis artery, it gives off branches, and these branches are called as the dorsal metatarsal arteries. These dorsal metatarsal arteries are the ones which are branches given off by the dorsalis pedis artery and by this arcuate artery. Itself, the dorsalis pedis artery, it continues forward and it is terminated at the first dorsal metatarsal artery, which is running over the at the level of the big toe. That is called as the first dorsal metatarsal artery. So this is the terminal part of the dorsalis pedis artery. Other than that, the rest of the four dorsal metatarsal arteries, the second, third, and fourth, are the branches which are given off by the dorsalis pedis artery, but itself it continues forward and it is terminated as the first dorsal metatarsal artery. What is metatarsal artery? The dorsal metatarsal arteries are the ones which are running in between the bodies of the metatarsal bone. If you remember, अगर आपको पता है metatarsal bone का structure, तो metatarsal bone का structure ऐसे होता है that it has got a distal end or the base of the metatarsal bone, it has got a small body, and then it has got a proximal end or the head of the metatarsal bone, which ultimately joins the phalanges. Okay, the phalanges of the toes. So ये जो dorsal metatarsal arteries होती हैं, they are running in between the adjacent sides of the bodies of the metatarsal bones. And over this level, they are joined by the deep plantar artery, which is coming, if you remember, which is coming from the sole of the foot. सोल ऑफ द फुट में हमने देखा था कि लेटरल और मीडियल प्लांटर आर्टरीज थी, वहां से एक और ब्रांच निकल रही थी, that was labeled as the deep plantar artery. मैंने अभी आपको बताया था कि it comes to lie superficially or it comes to lie anteriorly and it is joining this dorsal arterial arch. So at that level, this dorsal metatarsal artery, it is joined by the deep plantar arteries branches, and then they both together they constitute our dorsal arterial arch. They goes further, and these metatarsal artery, the dorsal metatarsal artery, at the level of the when they ascend forward or they goes forward, they are divided into other branches which are called as the dorsal digital branches, which are given to the digits or to the toes of the foot, and they are इस तरह से वो located होते हैं that they run side by side. Suppose this is the dorsum of the foot, so ये digit है तो इसके side by side run होंगे on either side of each of the digits they run, and in this way they are forming the dorsal arterial arch. Okay, so with that we have finished the dorsal arterial arch. Is it clear to all of you? Origin of the arcuate artery. अच्छा. Okay, I'm going to answer all of the questions one by one. One of you has asked regarding the deep plantar artery. Deep plantar artery, it's basically deep plantar artery is a branch of the deep plantar artery is basically a branch given off by the medial and lateral plantar arteries जो होती है उनकी branch निकलती है, that's called as the deep plantar artery. The deep plantar artery, it enters at the level of the intermetatarsal space. It goes from posterior aspect or from the solar aspect of the foot to the dorsal aspect of the foot or on the dorsum of the foot. Okay. Once it lies on the dorsum of the foot, it joins the branches of the dorsalis pedis artery over here. ये join करती है जो dorsal metatarsal arteries हैं उनको, and now they both of these branches, the deep plantar artery, the branches of the deep plantar artery as well as the dorsal metatarsal artery, they continues forward and they are responsible for giving off the dorsal digital branches. Acha, origin of the second, third metatarsal arteries. All the metatarsal arteries are basically branches of the dorsalis pedis artery. Okay, ये dorsalis pedis artery की branches होती हैं. Arcuate artery. Origin of the arcuate artery is from the it's actually a continuation of the branch होती है, you can say from the dorsalis pedis artery. Dorsalis pedis artery से वो एक branch निकलती है. So medially it is related to the dorsalis pedis artery, and laterally it is joined by the lateral tarsal artery, which is actually also a branch of the dorsalis pedis artery. क्योंकि ये एक आर्ट शेप्ड आर्टरी होती है, सो बेसिकली इसका जो ओरिजिन है आर्क्यूएट आर्टरी का, दैट इज फ्रॉम द डोर्सालिस pedis artery, but as it's an arch shaped structure, so laterally it is joined by the lateral tarsal artery. At which level the plantar artery joins the dorsal arteries of the foot? The plantar artery, मैंने बताया आपको जैसे कि intermetatarsal space से वो join करती है at the level of the body of the metatarsal bone. Okay, Amna is asking, is it necessary to do the articles of our It's all up to you. मतलब ये तो आपकी अपनी it's on your own convenience whether you want to do the whole of the arterial supply of the lower limb, or you can do it compartment wise, whatever is suitable to you. That's something which is related to your own study style. First, First, dorsal metatarsal artery is the continuation of the dorsalis pedis artery. Dorsalis pedis, not the arcuate artery. Arcuate artery की continuation नहीं होती. The first dorsal metatarsal artery is actually the continuation of the dorsalis pedis artery. The dorsal and plantar arterial arches and the metatarsal artery, yes, definitely they are connected to each other at some point, nahi, balki at the level of the metatarsal bone, they are related to each other. Similarly, हमने जो arches of hand पढ़े थे, वो भी एक दूसरे के साथ interconnected होते हैं. इसी तरह से जो arches of foot हैं, they are the arterial arches of the foot, they are also interconnected with each other. No, once it ये किसने पूछा क्वेश्चन? Okay, the popliteal artery, the femoral artery, it crosses the adductor hiatus, and over that level it is labeled as the femoral artery. But once it crosses it comes to lie inside the popliteal fossa, then it would be labeled as popliteal artery, not just after crossing the adductor hiatus. Arteries which are forming the genicular anastomosis are the branches of the femoral artery, the descending genicular branch of the femoral artery, and the superior, middle, and the inferior genicular branches of the popliteal artery. They are responsible for forming the genicular anastomosis. Deep plantar artery joins with what? At the dorsal aspect. The deep plantar artery joins the dorsal arterial arch by joining the metatarsal arteries, the dorsal metatarsal arteries. Okay. Okay, so I guess all your queries till now, they are clear. Okay. So we would be moving on further. Quickly, we are proceeding towards the plantar arterial arch. Okay, now the plantar arterial arch is basically formed by the lateral plantar artery. The मैंने जैसे बताया था कि posterior tibial artery, it is terminated by dividing into its two terminal divisions. One is called as the lateral plantar artery, the other one is called as the medial plantar artery. The medial plantar artery, it do not has got an extensive course, ठीक है? अब picture के ऊपर concentrate कर ले तो यहाँ पे नीचे label हुआ है the posterior tibial artery. The posterior tibial artery, it continues forward and it is divided into the lateral plantar artery and the medial plantar artery. If you look at the course of the medial plantar artery, it runs on the medial aspect of the foot, crossing the tarsal bone, then the metatarsal bone, then it comes to lie on the medial aspect of the big toe. So इसका जो course है वो comparatively बहुत restricted है, but specifically the plantar arterial arch is formed by the branches of the lateral plantar artery. Now, if you look at the lateral plantar artery, if you concentrate over here, it comes to lie over the tarsal bones, okay, then the metatarsal bone, और उसके बाद again ये भी एक arch की तरह से एक arch shaped बनाती है over the basis of the plantar aspect of the basis of the metatarsal bone. ठीक है, यहाँ पे over that specific part, it is joined by the branches from the dorsal arterial arch. जैसे deep plantar artery जा रही थी into the dorsal arterial arch, इसी तरह से जो dorsal arterial arch है वो perforating vessels देता है, and these perforating vessels from the dorsal arterial arch, they perforate the muscles of the which are running between the intermetatarsal space. They are basically the interosseae. ये उन interosseae को जो है वो pierce करती हैं perforating vessels. They come to lie on the solar aspect or on the plantar aspect of the foot. They join the branches of the lateral plantar artery, and together they constitute the plantar arterial arch. Again, they are divided first into the plantar metatarsal artery, which are running in between the intermetatarsal spaces on the adjacent side of the tarsal bones, metatarsal bones, and then they continue forward and they are divided into the plantar digital branches, which are running on either side of the plantar aspect of the toes. इस तरह से जैसे ये toe है, so इसकी either side पे run करेंगे. इसी तरह से ये एक toe है, तो इसकी either side पे run करेंगे. So ये branches होती हैं that are given off by the lateral plantar artery, and they are joined by the perforating vessels given off from the dorsal arterial arch, and together they are constituting the plantar arterial arch of the sole of the foot. So with that, we are almost done with our today's session. Okay, if you have got, again I'm asking if you have got any query related to the topic.